Good afternoon, everyone. I'm going to switch video on just for the introduction so that people know who I am. So I'm Nabila. I am a lecturer in the Center for Health Science Education, and I currently run our Faculty of Health Sciences Simulation Lab. The purpose of today's session and what we're hoping you will gain from the session is practical, strategic ways in which we can debrief both in the teaching environment as well as the clinical environment. Essentially, this stems from a lot of the work we do in the simulation lab and thinking about doing things differently in the real world. So how can we utilize debriefing strategies to create safe spaces around us? So I'm going to switch video off because if you are at WITS, you'll know WITS Wi-Fi is absolutely terrible. Is there an echo for everyone? I'm seeing the chat.
Not for me.
Okay.
I also don't have an echo.
Okay, perfect. So that's the purpose of today's session. E- Everyone who does or has interacted with us in the simulation lab and in our environment will know we try to be as interactive as possible and get people to reflect and share experiences in the hopes of developing reflective practice and improving our own thinking and, in this case, our own teaching practice. So I'm going to get quite interactive with quite a lot of people today. So I do just ask that you indulge my own antics. So just to kick us right off, our objectives for today, I'm hoping that we're going to look at describing the difference between debriefing and feedback. Especially in some pedagogy, we speak about it quite differently. We're going to look at strategies to create safe spaces for debriefing and ways in which we can develop that safe space. And then to look at now in debriefing in a safe environment, which is like the simulation lab, how can we take what we do in the sim lab and practice it out in the real world where some of the debriefing strategies are needed. Okay, so the interaction starts now. So I'm going to ask you to, in the chat, please think of an experience or, something related to how you feel about the concept of debriefing. So it can be linked to, debriefing practices that you've had or how you're feeling just about going into this topic, which can be seen as quite big and quite vulnerable. And just an emoji, even a GIF or a word in the chat or an expression. If you're tired, that's okay too. Thanks, Mohammed. Always hype. Okay, upside down smileys, normal smileys. Okay, at least we're not too stressed out as yet. I'm going to give just 30 more seconds for people maybe to find the GIF button or the word. Catherine, I definitely agree that when we think of debriefing, the thought of militarian concepts come in of something traumatizing has happened, and now we have to debrief about what happened and why it happened. Definitely. Okay, 10 more seconds. Okay, I'm going to ask you to hold on to a lot of those emotions and what you're feeling. We're going to come back to it right in the end and see if we've managed to change your perspective or your mindset or how you initially react when you think of debriefing with someone or debriefing someone. So the whole point of debriefing is reflective practice. And I'm going to ask that if you would like to share it verbally, I'm very happy to have that. If you'd like to type it out, please start typing now. But I want us to think of a clinical experience when you were a student. So way back whenever, or an experience if you non-clinical, a teaching experience when you were a student, something that may not have gone as well as you would have hoped. And this experience required a bit of debriefing. And I want to find out if you did have this debrief. If so, how did it leave you feeling? And if not, what happened with that experience? How did you try to resolve or deal with it? I welcome raised hands. Okay, maybe we'll just give a minute for people to think back a bit. N. Mudley. Navesh, is that you?
Hi, Nabila. Yes, yes. um, I'm not sure if you actually remember this or you had left at the time. When I was a student, I struggled with women's health a lot. Until this day, I still do. And it's not because I don't know what to do with it, well, for obvious reasons. And during my coming out phases, I struggled with PV exams and I was never debriefed. I remember I had a facilitator at the time where she tried her best to get me to do it, putting up a green, holding up a cloth in front of a patient, and so that the patient doesn't see my reaction, and trying to get me to do it until the point I get there, and I remember leaving the hospital at that point, and I told her, listen, I'm not doing this, and only when I was qualified, I got to do it. I had to do it. Now it was forced upon me to do it because there's nobody else to do it. And till this day, I still have mixed emotions about it and never been debriefed about it.
And I'm going to push because you also unmuted. Those mixed emotions, are they? Do they leave you feeling that something's unresolved or that you haven't improved clinical practice? What can you describe the mixed feeling for me?
Okay, so the mixed feeling lies within the fact that I'm able to do it, and now it's more of a numb experience. It's not something I would go to do or want to do, and when it's time to do it, I'm just like, okay, it's one of those things versus me wanting to put an IC drain, for example. Different total experience emotionally for me. And it translates now in my teaching. I do teach it, and I think I teach it well, but again, the feeling comes across numb, and even the way it projects, it's not something that, like, my students can tell it's something I don't like. So they can see it evident on my face. So it translates in teaching as well. So I don't know. I think numb is the most appropriate feeling I can tell you.
And I think that's so valid. Am I correct to then assume that that experience and not fully debriefing about it and figuring out what was going on has affected teaching practice? That's what
Yeah.
I'm hearing. Okay.
And teaching it, the feeling is just, mutual, numb, neutral, whatever you want to call it, but I would have not liked it to be like that. I would have liked it to be different, but unfortunately, debriefing would have been something nice had it been done then, to have actually come out of that.
Definitely. I appreciate the share. Thank you so much. Daniela, I see your hand. You may be muted still.
Hi. So I'm just thinking, I'm going to go back to like when I was in my final year. I did a lot of my rotations at the old Natalspreid as it was slowly crumbling before it became tele. And I remember so much violent trauma. And the one that to this day, it shakes me because we didn't even debrief about it. And just the fact that everybody just was so normal. We had a gunshot wound, multiple gunshot wound patient came in. It was pretty much a DOA, but he was brought in by his family. It sounded like taxi violence. And yeah, the wife was also there, and the sons, there was like a bit of commotion and crying. And within 5 minutes, the sons just said, well, obviously they were speaking Zulu, but they just said, "We're now going to avenge you." And they literally like just walked out of the recess and never came back again. And like, I was so scared. And I was never debriefed on that experience. I was not debriefed on what I was seeing, even the commotion that the families, the way that they were dealing with the grief, and then even hearing words of like guys going back into this like war zone mentality of like, and now what we know about gang violence, I mean, taxi violence and the likes. But it's affected a lot of like, not just so much my comfort in teaching in our public sector, but like especially I don't see myself as somebody who is ever comfortable in like, especially now I'm in Tambo, but I then always think about like, it's made me reflect on just the type of environments we send our students into. And it's got me reflecting on like, it's saying if I was traumatized like in that kind of incident, the fact that I kind of like am part of perpetuating that kind of experience, yeah, so it's just stuck with me ever since.
I can imagine. And I do want to say thank you just for sharing that. I know that we can't debrief fully on everyone's experiences in this forum or in this context, but I think just feeling comfortable enough to reflect on that a little bit in this space, I'm hoping is valuable in seeing how we can do it elsewhere or how we can incorporate it in our practices. And I also can definitely understand how, not being exposed to a safe space where you can debrief about something that is quite traumatic, can trigger once again when you're in that environment again. And I think everyone could be able to appreciate that sentiment. I know Yandisa and Zuki has posted in the chat as well that they don't really remember ever being debriefed in clinical work or clinical experiences. And I think that's telling, which then brings me to the next question. If no one else has things to share. Okay, I'm seeing Catherine in the chat. Emmanuel, I'm going to give you 2 seconds while I just read Catherine's comment and then reply. Catherine, I think that's so important of acknowledging the first step, but then giving feedback. It's something that I have needed to reflect on quite a bit, to actually be respectful and make time, but maybe not always getting the outcome that you want. And I wonder, I know you've currently got laryngitis, so maybe in the chat you can post it, but I wonder if that interaction of trying to get some kind of debrief or some kind of feedback, and being interrupted changed your perception of the entire topic or field going forward. And maybe while you reply via typing to that, Emmanuel, please go ahead.
All right, thank you. I mean, what actually comes to mind is that I can quickly pick on is the experiences we had during COVID, where I mean, the pandemic came at a time where we didn't know much about it. I mean, I'm speaking in terms of what nurses, including myself, did recall, where I mean, patients were dying every second, and once you see a patient die, there's another patient coming in. So we couldn't get the time to even share anything, So it looks like once you are almost about ending your shift, there's another patient coming in. So there was no space to even talk to anyone about their experiences. So more or less, we tend to shelve all those experiences because there were huge number of patients coming in, fewer healthcare professionals. So you more or less go home without talking or speaking to anyone about your experience. So there was no avenue to debrief. You come back again in the morning to continue the routine. So it actually brings back to mind that essence of debriefing when it comes to a population like the nurses, for instance, who are constantly with patients for a period of 24/7, seeing people die, seeing people go through different traumatic experience. However, we don't get that opportunity to debrief whatever we experience during our shift or during the day.
Definitely. And I think you speak to so many important points in the nursing profession around the time and the time spent with patients, the type of connections built with patients, and how that impacts, your daily work. Uh, I think that's so important. And I think for me, it highlights even more that, corridor conversation sometimes might not always be enough as a simple debrief. And especially, as you related to COVID times, there was so much that happened that I think people might still be traumatized by, and haven't fully understood or unpacked how they reacted to so many things when they were in fight or flight mode. So thank you for sharing. I know I've opened up a bit of vulnerable conversations, but I'm really grateful for people to feel comfortable enough just to share that with us in the room as well. I'm going to flip things now a little bit and ask, now in your clinical teaching experience or your teaching experience with your small group of students, while you're being a facilitator in a specific environment, can you identify an experience where a student might have needed very specific feedback or debriefing about a situation, and how did you go about this conversation? Did these past experiences that you all shared, did they contribute to how you now respond to students or interact with students? How does that go? Yandisa?
Good afternoon, Nabila, and to everybody else. To answer that question, I actually, as you're asking the question, I'm realizing I'm poor at debriefing. And I think it's partly because it's not something I'm exposed to. I'm aware of it and I understand its importance, but I have never in my life after a poor outcome have I had a debriefing. So it's not something that I automatically go and do. I think probably the first time I was actually ever involved in a proper debriefing was with you and the students at the sim lab. So unfortunately, I think because it was not something I was ever exposed to, as much as I'm aware of it, when the time comes, I don't always, I rarely think about it actually, which is sad.
And I think it happens. And I think it's so justified for that reaction also. We've all been cultured, I assume, and brought up in ways of, pushing the next thing. And I think in healthcare, that's been a lot of the fundamentals of what we've been doing. And it is one of the reasons I appreciate the lab being the space where we can do that debrief. So I'm glad that, that opportunity you were there for, and I thought it went really well. Any other thoughts or experiences, student interactions? Monica.
Hi, can you hear me?
Yes, loud and clear.
Okay, so I am a genetic counselor, and part of our training for the students, we make debriefing mandatory, and they have monthly supervision with a psychologist, and then they also do debriefing with us as genetic counselors, just trainee and supervisor. And just recently, an experience I can think of was a patient who watched a student who watched a patient have a termination of pregnancy. And she had kind of phoned me to discuss the case, and because we can't obviously always be there in clinic with them, especially if we're supervising other students. And just from her experience and hearing what she had been through, I think being a student myself, I knew what kind of emotions that might raise. And so it was something that I was very conscious of. And I actually ended up calling her later in the day and just checking how she was. And then we organized a debriefing for the following day, just so she had an opportunity to kind of discuss how she felt and talk through the experience, which was very helpful for her and it was helpful for me. So yeah, I think we do that. We are quite fortunate that we do have that exposure and we do it quite often, but it's definitely something that sort of stuck out in my mind that happened more recently.
I agree. I think that's such a good practice. And it's really nice to also see that students do have the opportunity to debrief. And I think that's those supportive measures sometimes make such a big difference and in just getting the conversation started, even if they may not be ready to fully open up and debrief as yet. But thank you. Mervyn?
Thanks. Good afternoon, everybody. I have a couple of comments, if you don't mind. The first one was prompted by Monica's statement about this feeling of her exposure to the student who witnessed a termination of pregnancy. And that for me is a very valuable one, because it says to us that perhaps besides the debriefing, but we're not briefing our students properly. So that debriefing, in fact, probably meant more to Monica than it did to the student, because she grew immensely from that in terms of educating in advance. That's the first point. Second, I'm in Yandisa's group, as you well know, and was only exposed to this whole process this year, and it's been an amazing experience for me and prompted me to think that at our level, and I'm talking to us as a group, who debriefs us? Who of our colleagues or our seniors comes to us and said, how did you feel about it? What were your issues? So the debriefing experience works at two levels. One, that we do it to our juniors to help them grow. But in fact, I believe it should be done by our colleagues to help us grow. Thank you.
Definitely. I can relate to that so much. And I think I saw one of my fellow sim educators on the call. So Kashmira is from the Department of Anesthesia, and um, the debriefing, the debriefer has been essential to us figuring out, one, how to improve, but also difficult conversations we might have needed to have in the debrief. And I mean, we're fortunate in the simulation environment to put those measures in place to say, after simulation, we will have a debrief. But in the real world and in the clinical environment, that doesn't always happen. But even in our environment, I'll give an example of, we had a simulation last week, and some of the way in which the student interacted with me as an individual became a little bit disrespectful and a little bit personal. And I had to navigate balancing reacting the same way to them or switching it into debrief mode and creating, the mirror effect of, you might be saying this to me, but let's find out what your thought process is that's making you say this. And I needed to debrief quite intensely after that. So I think I can relate so much to that need. And sometimes I do think these conversations and this kind of community of practice is invaluable to a lot of us as academics. So I can relate to that so much. Other thoughts? Anything else? The pre-briefing, yes. Thanks, Monica. So I think the lecture, the pre-brief, as you say, can't always prepare them, but I think it can scaffold. Unfortunately, we can't prepare them for everything, but I think putting in those supportive measures can make such a big difference. And then Danelle, I do agree. I'm hoping that after this session and, you know, people will be prompted to come and have some debriefing workshops with us in the lab, and we can practically run simulations and debrief about it. Okay, I'm going to move us along a little bit, and I think we've discussed a lot of this, but I'm going to try and structure it a little bit more to say, we can see how in a lot of the stories everyone has shared and the interactions we've had with students, the value we've seen it can have in the clinical environment. And now my question to you is that in clinical simulation, what we try and do is replicate a real environment, be it for you know, different types of healthcare workers, to undergraduate, to postgraduate students, or team-based approaches. And that essentially is a safe space for learning because it's a controlled environment where they can run through a clinical scenario. And my question to the group would be, if this is safe and it's so controlled and we're watching what they're doing, why do we debrief about it? Why not just give feedback in saying, this is what do you think you've done well? What do you think you haven't? Why do you think that we're reframing what debriefing is in the context of health professions education? Might have been a loaded question.
Hi, Nabila.
Hi, Anne.
Hi. So from what I find with the debriefing, it's kind of like, instead of just giving feedback, I find it like actually allows the student to verbally reflect and acknowledge what's just kind of like happened and occurred. But then also like within a group, then they kind of hear each other's experiences and other thoughts and or like solutions to those experiences, and like it gives them more to consider. So I don't know if this is making sense, but I feel like it's a verbal reflection and like work processing of what's just happened. Yeah.
Yes. So it's that opportunity for them to verbally talk through what they've done and why they've done it. And which does take a lot longer. Other thoughts? Anything else to add? Okay, so I think the concept of reflective practice is the biggest thing, where after a simulation, the hope is that, you know, we sit down and we, for lack of a better word, actually analyze and dissect what happens. But the way in which we do so is significantly different. And I'll talk through how we do that and how we create this safe space. So in simulation, one of the concepts or the core concepts we talk about is psychological safety. And when we talk about psychological safety, it's for the participants and for the facilitators of the session as well. And we try and do it through various ways. So within the simulation context, the first thing we do is what we call a pre-brief, where we'll orientate the participant to the environment, to, you know, the time the scenario will take, to what we do. We give them opportunity to get comfortable with the mannequins we have, the tech we have. They feel, they touch, they open drawers, they see what's there. And then we give them what we call a clinical vignette, which is your, you know, scenario or your starting scenario. And then we immerse them in the simulation. Throughout the simulation, we don't interrupt them. So we let them run through the simulation. If they are doing something that's really wrong, we do what we call a pause and perfect. So we'll pause the simulation, ask them to talk through what they're doing and redirect them, and then let them continue. Anastasia, I'm going to take your hand in 1 second. And then after the actual simulation, and if we're talking simulation design, it's a whole other hour. So I'm not going to focus too much on that. And then after that actual simulation, actually do the debrief. And our rule in the lab is that the debrief is always double the amount of the actual simulation. So if your simulation was 10 minutes, your debrief is 20 minutes, if not longer. And generally, we find that structured approach helps the students quite a bit to preempt and prepare themselves what the session will look like. We don't debrief around the bed, and we don't debrief very close to the environment where they just had the simulation. We take them out of that environment, set up pretty much what you see on the screen, a circle in the debrief area of the lab, and then we work through step by step the process and what happened. And that's one of the ways in which, or the overall picture of how we create a safe space. The other ways is how we ask questions, and I'll get into that in about 5 minutes. And then it's how we position ourselves in the simulation. We know there's a power dynamic, and we know that we're seen as figures of authority to have the information. But in the simulation, we work a lot more on a collaborative approach where the student or the participant will say something and we can learn from them. So in a nutshell, that's some of the elements of psychological safety. Anastasia?
It's a historical hand, Nabila was struggling. Sorry.
No problem. So essentially, what we're trying to say is that when we're creating a psychologically safe space, we're very aware of how easy it is in the simulation lab because it's designed in that way. And while we're going through these conversations, I think we want to reflect a little bit on how can we take some of these psychological safety concepts into our daily practice. And it might not be, you know, the 30-minute long circle kind of session, but it could be it could look quite different given your objectives and your concepts. So before I give you a bit of a practical example, we use different methods and different approaches to debrief in simulation. The one is called debriefing with good judgment, and I like the Pearls tool. There are a lot of other tools that are out there and available. I find the Pearls tool provides a bit of scaffolding and structure to direct the conversation. And essentially, it speaks to what Danelle was saying in the chat, in setting the scene, in guiding the conversations. And you'll see what they do in the beginning, or at least the first two, is what I tried to get all of you to do in the beginning. So it's setting the scene, creating that safe context for learning, re-emphasizing that this is a safe space to share. You're not harshly judged here. You will not be critiqued or interrogated in the space. And we try and actually say that. I normally sound like a broken record, but we try and say that quite a bit. And then we explore the initial reactions as soon as the simulation ends. So we want to understand what is going on in your mind as soon as we said, okay, the simulation is over. And often you'll see they'll use words like overwhelmed, traumatized, triggered, sad, depending what the simulation was about. And then we go into a bit of a description. So we ask the participants to give us a clinical overview of the patient or of the case. And this allows them to then sit back and reflect on every step that happens. At this point, we don't ask them to explain why they did it. That comes later on. We just want the facts. Then we go into the analysis. So now that we've got the facts, we then go into each part of what they've said, and then we explore. And the way in which we analyze becomes very tricky from a lot of the ones that I've tried to be in. And the reason is it depends on how you phrase questions to allow people to open up or to shut them down. And what we've seen is saying things like, you chose the wrong drug why did you choose that drug, isn't creating a very safe space. Or, you spoke to the patient in a very inconsiderate manner. Were you upset with the patient? And that to the participant shows them that we've already showed them that we have a perspective of their training, their competence, and it dampens their confidence. And very often after that, they might not then tell us why they reacted in this way, or their train of thought to then recognize the need for change. So something along the lines of, I observed that this is the drug that you had chosen. Can you describe to me why this was the drug to best manage the patient at that time? And that opens it up for conversation. And I'll show you how we try and create those questions. And we're going to do something a little bit fun to do that, I hope. Okay, so for people my age and older, you'll remember the show called ER. I'm going to play about 2 minutes of the clip. And what I'm going to ask us to do afterwards is to debrief the surgeon that came in to intervene with the patient. And I'm going to ask people to think of one question that you would ask this surgeon. And we'll talk about the phrasing of the question and what we're trying to find out from the person in an attempt to debrief them. So remember, we're not giving feedback on whether they were right or wrong. We want to debrief them to best understand why they reacted in that way and performed that action. If the sound doesn't play, please let me know.
The sound is not playing.
I can't hear anything.
Nabila, you can also post the link for me and I can play it.
Yeah, just drop the link in the chat and Christine can pick it up.
Call anesthesiology and get an ENT surgeon down here now, please.
Hypoxic.
It is working.
50-year-old crash and collapse mode.
Oxygen sat 70 and dropping.
All right, laryngoscope. How long's he been out?
Less than a minute.
Sore throat. This came on fast. Where's the mother?
Waiting room.
Can't even see his cords. Connie, see if we can get an air bubble. Suction. This tube is too big. I need a smaller one.
Diminished breath sounds on the right. Hyperresonance. Okay, we got a tracheal shift. Oh no, tension pneumo.
Gotta be the small ET tube. Where the hell are they? Bottom drawer.
What's Doug got in there?
I've got a guy tied to a 6-year-old.
He's flying out.
All right, give me a 14 gauge needle. Got it. Congratulations, Mr. Gentleman. You're gonna live.
Swollen shut. Yeah.
Carter, do me a favor. Take this. How long have you been out?
Coming up on 2 minutes.
What about a needle crack?
Not yet. What are you doing?
I'm going in.
I said not yet.
Pele, hook up a 3.0 ET tube hub to a cath and bag them. Hyperventilate now.
O2 sats up to 95.
Start them on 750 milligrams ceftriaxone IV Q12.
Okay, so I'm going to stop sharing. I'm going to ask us to decide. You can decide which doctor you'd like to debrief, and I know this is a very doctor approach to who we're debriefing. So we're not focusing, like Danelle said, on the clinical practice or the intervention. What I want us to focus on in the debrief is what was perceived as a possible conflict. And I want you to decide who you would like to debrief and pose a question to them. And I will play the role of that person and respond. Yandisa?
Are we supposed to type or just raise our hands?
No, you can say it, it's faster.
Oh, okay. So the first doctor, seeing as we are addressing the issue of emotions first, is how did they feel when the other doctor just took over instead of assisting? Because he didn't assist, he just kind of like did what he wanted. So how did he feel?
So I felt like my skill set was not being respected, and I was not being given the opportunity to explain why I was delaying a surgical intervention.
Okay. And do you think, again, I feel like I might be treading on thin ice here. Do you think that, or rather, no, let me rephrase the question. What was your reason for delaying the surgical intervention?
So this was a pediatric patient, and I did not want to perform a surgical crike in an unstable, uncontrolled environment.
Okay. I think I'll leave others to also ask.
Okay, and then we can dissect those questions in a bit. Suki?
Sorry, I had to find my mic. So I would like to debrief the doc who came in and just took over.
Sure.
So what did you see that was going on between what you were doing and what was going on next door?
So I saw a child needing immediate airway management, and it was not being done sufficiently.
Was there anything in particular that led you to feel that it was not being done sufficiently?
They had said that there was 2 minutes without any change, and I did not feel this was okay.
What about chatting with the doctor that was actually trying to put in the scope?
I felt like it was a high stakes situation, and if I was able to perform the skill and save a life, then why not?
Okay, I'm going to be like Yandisa. I'm going to step away because now I feel like screaming at you. But
which is the whole point of debriefing, trying not to do that. Okay,
So,
anyone else?
thanks.
Anay?
So, we're talking, I just want to check, are we talking in terms of if this was like a simulation?
Not really. You can go for it as though it's actually real hospital experience.
Okay. Yeah, sorry, I didn't know the answer there. I was just trying to get context, yeah.
Okay, no problem. Anyone else want to give any question a go? Something that, or maybe something that you want to find out, but you're not sure how to phrase it? Patience.
Can you hear me?
Yes, I can.
I would like to find out if the second doctor is planning on having a debrief with the other doctor, maybe during lunch or any other time that he thinks is more appropriate, just as a follow-up.
And how would you phrase that question to the doctor?
Do you think the way you intervened in the case would need you to have a conversation about it with Dr. Who?
I don't think so. I feel like I saved, or are we going with the other doctor, the first one?
So this is the second doctor who came and intervened. I'm asking them.
I feel like I saved the life and I performed the job that I get paid to do and that I've qualified for. And I don't feel as though I should talk about it because I did the right thing.
Okay, I'll step back now.
Okay. Anyone else want to jump at me?
Sorry, just a question. Sorry, I forgot to raise my hand. Is it me or is this other doctor sounding very arrogant?
Well, that's the point of trying to get you to try to ask your question, but not, punch me.
Yeah, he's very triggering, I must say. Anyway, that's all I was asking.
Okay, so on a side note, to be quite honest, that's what I'm trying to get at, to show how can you get someone to actually identify something without you saying it. So very debrief technique. Ane, I saw your hand.
Sorry, I have like an idea for a question and I pull back. I think for me, I'm thinking about more along the lines of not really asking. I'm just going with like how I debrief my students after their step session, for instance. Where I'm just like, how did it go? I don't ask direct questions. So I'll just kind of start with like, how do you think it went?
Yeah. And I thought it went well because the patient's alive.
Okay, cool. So then having noticed that, what can you commend yourself on, like that you did particularly well?
The surgical intervention.
Okay, and is there anything you found that, is there any, like what went wrong?
Well, the fact that there was delayed time to make the call for the correct airway management.
Okay, and then why do you think that there was this?
Well, I'm not sure. I don't know why they delayed the time.
Okay, cool. That's it from my side.
Okay. So I'm going to take Catherine's question, but I'm going to take Sue's question first. And I'm going to try and respond to you a little bit, Ane, and to others before we go to the next set of, I think, 3 questions. So the one thing that I would pose back is to say sometimes, and I think it's with a lot of questions that we do get. So something along the lines of, what do you think, you did well, does work really well for skills. One of the things I was trying to get from this particular conflict scenario was trying to phrase a question in a way that they identify that there was a problem with their communication. And I think, so Catherine, I'm going to come to your question in a little bit. And I think, Sue, one of your points is so important. And I'll maybe put you on the spot a little bit and find out, how would you phrase a question to the nurse to find out what their perspective was, and maybe to find out what they did or what they didn't do and why?
I think I would ask them how the whole situation had made them feel, first of all, and exactly what you're saying. Is there anything in retrospect that you would have done to change the situation?
Yeah. And I think that's important. One of the things we do within debriefing is change a little bit about that question and the question that Catherine has asked. So sometimes what we do is things to say like, I observed that while the doctors were arguing, you were quite quiet, but you looked like you wanted to say something. Was there anything that stopped you from saying something? Or in the follow-up to how they felt if they had wanted to do something. So Catherine, to your point as well, some of the things of any way in which your arrival could have been better managed. I like the phrasing of, the patient was better treated, but not only alive. Sometimes that can come across as saying, so when I arrived, it wasn't good. And sometimes it's emotions we have to manage. And I know it sounds very fluffy, but in debrief, we try to tread very carefully on how we ask questions. Brian, I saw your hand. And then Brian is a seasoned debriefer, so maybe you can come in also.
No, I don't know about that. I was just thinking, the point you guys have just made, I think that the nurses should be involved as well. I think that's very important because they've experienced it, and there's actually been cases like this where the nurse has been watching, like with a cockpit view, seen what the doctors were doing wrong and was too timid to say anything, and then the patient suffered harm. So it's important to empower everybody in the room so that they learn for the next time, and to know what to do. The problem we had, both doctors were going against guidelines. And then I think perhaps to ask the people concerned, to cool down, calm off, and maybe try and schedule a debrief a bit later when the emotions aren't running so high, because that might be more productive. As I said, it's the person who is suffering the most here was the patient, and it was emotions and egos that were getting out of hand from I think both doctors really. That's a lot to say.
Definitely. Thank you. And I think those points are really important, that sometimes or often we pick up on one aspect of management of a case or a patient, and we debrief or we give feedback to the individual who was seen to be the most involved, but we actually don't fully comprehend that the entire team is dealing with the exact same emotions, and it needs to be a team debrief. Monica?
I was just going to say that in theory, you'd want to get the doctors to empathize with the other person. So particularly the second doctor, you almost want to ask a question around how he might have felt if he was in the other doctor's scenario and someone had come in and second guessed his decision. Could he understand why his colleague may have been upset with him?
Yes. And I think
Yeah.
that would be an important starting point, that maybe saying, from our observations, it came across as though you second guessed the first on patient decision. What were your thoughts around that? Or how do you think that was perceived by the person who was managing the patient? And sometimes just flipping that question without saying, I'm judging what you did, can make quite a big difference. Quite a lot of the time. Any other thoughts? Any other ways in which you'd like to ask a question? So maybe the nitty-gritties of why I sound like I'm tiptoeing around things. So when we talk about the analysis phase in debriefing with good judgment, we talk about advocacy and inquiry types of questions. And essentially what we're trying to do here is to promote self-reflection. We know that as educators, we hold that information, and it's very easy for us to just tell the student, this is what you should have done and this is why you should have done it. But actually trying to understand in that context, in that high pressure situation, what was going through your mind that made you react in this way, makes that difference in reflective practice. So often you'll see that when we debrief, we use the advocacy, the A&I questions to say, you know, I saw that you came into the ER quite aggressively, maybe not using that word, but I saw you came into the ER very quickly to manage this patient. I think, you know, my assumption is that you wanted to save this patient's life and you had thought that the surgical airway was the best way in which to do so. I want to understand what your thoughts at the time were about taking over management of a patient that was being managed. And I don't know what your thoughts are about how that was phrased. I'm not saying it's always right, but I would like just a bit of comment on how that phrasing or how that sits with you.
I seem to think that a doctor who came in with that kind of almost like arrogance might find that question quite accusatory. So yeah, I don't know. I think a lot of people, if they kind of make a decision and they're going to stand by it, then they normally come into these sessions being quite standoffish about, you know, that they're going to stand by their decision and do what they always would have done.
That's true. Zuki, do you want to respond?
No, I don't know if it's a response so much, but maybe just kind of adding to the dialogue. I think that's why my first question was how that particular doctor saw the situation. Because yes, there's an element of arrogance, but you know, your response was, yeah, I wanted to save the person. Okay, so then I would be like, well, do you think you're the only one that could save them? But that's another thing. But the point is, and I think it does kind of allow some self-reflection if you kind of also see where they were coming from. And I think that's why I wanted to kind of find out what their point of view was, what their bird's eye view was first, you know, even before I say, well, I saw this and this is what I think.
And that's so that's important. So the first point, so as Monica said, if you say this, definitely can come across very accusatory, especially if you haven't done the foundational question to say, okay, what was going on in your mind? What was your frame of reference? And we talk about frames. So we say, you know, you come with your own frame of reference. And when we talk in the debrief, we want to find out what was that frame and how did that contribute to your decision making. And of interest, if you do, I'll put the link in the chat if you want to watch that whole scene. But they do have a conversation at the end and to find out that the doctor who then came in and immediately did the CRAG was doubting his own leadership and surgical skills because he was rejected for a certain position or something to that effect. And they had that conversation outside, which then put different perspectives into light to say, okay, it's not about whether I see you as competent or not. And I think those conversations are quite important. We're not saying we'll always get it right, but I do think just, you know, one or two probing, safe type of questions can make a difference. So I know we've run out of time, so I'm literally not going to focus too much on this. But I will say, having these conversations, and after listening to me rant on for about an hour, are there any practical approaches that you've gained from this session that you feel will help in clinical practice, both with colleagues and with students?
Don't watch ER.
Sorry, I missed that, Mervyn.
I said we mustn't watch ER.
Oh, definitely. You can, and tell students not to quote Grey's Anatomy every time. Anastasia, and then Yandisa, and then Zuki, and then we'll wrap up.
Thank you so much, Nabila. Always a session to learn. For me, I don't know if you can hear me nicely, but
yes, I can.
Yeah. So just for, like I said, I wasn't able to watch the video for connectivity issues, but I'm just asking, in a real life, I know this is like in, like a teaching scenario, but are there places or settings where someone would say, I don't want to receive feedback? I am not, is there something, could there be a scenario where someone actually refuses to get feedback because they, for different reasons, and then how do you deal with that? Thank you.
Thank you, Anastasia. So maybe I'll put it to the group that might be in clinical practice much more recently than me. Has anyone been in that situation where someone might not have wanted feedback, and how did that go? Okay, we'll think on that, but Yandisa, do you want to add? Or
No, what I wanted to say was, because you asked how it could change things for us in the future. So I'm hoping that the repeat exposure will trigger my brain that when a moment arises that I actually debrief with whoever's involved. So that's what I'm hoping for. But I really appreciate the way you put the way you phrasing the questions, particularly when you were phrasing the kind of question you would ask the nurses. Like as you're phrasing, like, "Ooh, that really does sound good," because I think, I mean, we're all kind of like nurtured and have different nature within us. I've realized that I tend to be very accusatory sometimes in the way I ask questions. And I actually recently had a registrar, and sometimes I'm saying it in a joking manner, but people don't receive it that way. I had a registrar who's now a consultant and who told me a few weeks ago how much I traumatized her one time because of the way I'd asked a question when there was a negative outcome in a patient. And sometimes we don't actually recognize or realize our own faults when we're asking people what's going on. And even though it's not our intention to hurt people or to traumatize them. So I'm hoping I will be better in the future.
Oh, definitely. I appreciate that feedback also. And those are hard conversations to have and to reflect on also, because it does play to a lot of, I think, insecurities. But maybe just to touch on what Anastasia was saying, I don't think we'll get to everyone, and I don't think everyone is open to feedback and to debriefing in a specific way. But I think, it doesn't hurt to try. I don't think you can force someone. But you can try. Okay, Suki, Anastasia, Brian, and then we will close.
Thanks, Nabila. I think my takeaway from this entire session is that, when you really want to start taking debriefing seriously, I think you really need to have somebody there as well to kind of, I don't know, is also a support system for you, even though you are the debriefer, because I think you also need to then have somebody say, because like Yandisa was saying, sometimes you say something, but you don't actually know how somebody else is going to take it. So I think to start to debrief without somebody else there to quote unquote hold your hand, or to not necessarily to assist, but even to give you feedback, I think is really important. Because when I'm listening to everything that, that we talked about, I'm thinking, yeah, I think sometimes maybe I was not quite constructive, and it would be nice to have somebody there that could say, maybe do it this way or try this way or something like that. Yeah.
Yeah, the love of co-debriefing. Anastasia?
Yeah, thank you so much. I totally agree with Izuki's comments. My thoughts are, is it, well, within a teaching setting or in real life settings, I think one of the things that may help with scene setting is actually pre-scene setting to say, guys, at the end of today or at the end of this, I don't know, you're all going to get some, we're all going to have to debrief. Maybe a rotation, maybe a block, maybe a shift, like Emmanuel has spoken to, maybe a season, maybe the, maybe, I don't know, whatever it is and for however long it is. And then there's an expectation for this to happen, and then it helps, to just speak through or listen. And I totally agree with Zuki that it is an art to learn to debrief. Yes, the pearls you've spoken to looks like a very good, helpful outline, but it's a whole new language to learn for the fact
Definitely.
that it was a deficit for us or a gap for us growing growing into the profession. So it's a whole new language. It's a whole new getting used to phrases and all that. But thank you. One of the things I wanted to just reflect on is, so when we have students who are deregistered and come back, it's a form of a session where you try to get them to reflect on what made them get to that point of failing the year and what they've done. And my takeaway from this is making that session slightly more intentional, using the right words. It's a session that has obviously a psychologist and the support officer in it, but intentionally also maybe stepping back and ensuring that it's a session that debriefs their year away before they come in, because I think from my experience, a proper debrief would make for better learning or deeper learning going forward. Thank you.
Oh, definitely. I love that idea. Thanks, Anastasia. Brian?
Thanks, Nabila. I think I'm echoing Anastasia again. I just wanted to say that as much as, we've got to be so careful with debriefing, and we've got to try not to offend anybody and all of that, you can't shy away from the fact that you have to go back and make it a teachable moment. And I think revisiting the guidelines, for instance, is a good place to start, And if people are not defensive, you can break down to a point where they're not defensive. They can look at the guidelines with you, and then they could perhaps say, well, oh, I see where I went wrong or whatever, and learn from it. But the guidelines or the current wisdom of how patients should be managed, that is critical to come out at the end of the debrief, more even than I think people's feelings and so on.
Thank you so much. I appreciate that. Daniela, I would like to take your hand, but it's 5:10. And I do want to, I'm conscious of people's time. I'm sorry. Okay, I was going to ask everyone to put in the chat, if you put in an emotion and a feeling in the beginning, at the end, to just tell us how you're feeling, how you're feeling about the session. A word, a GIF, an emoji works just as fine. Oh, and then I had my email there. Okay. So if there is any further questions or follow up, or you'd like to come with us in the lab, we always try and accommodate and be as accessible. But thank you. I appreciate the interactions and the engagement so much. I would have just been talking to myself. So I appreciate everyone's joining and coming in. I enjoyed the session thoroughly. Thank you so much. Have a great afternoon.